We will start with the consent agenda, which all the following items which concern reports and items of routine nature normally approved at AHA meetings will be approved by one vote unless any trustee desires to have a separate vote on any or all these items. The consent agenda consists of the discussion, consideration, and action on the following items. Minutes of the special trustee meeting December 9th, 2020. Minutes of the special trustee meeting December 21st, 2020. Minutes of the regular finance meeting December 15th, 2020. Minutes of the special finance meeting December 21st, 2020. Minutes of the regular finance meeting January 19th, 2021. And a check report November 9th, 2020 through January 8th, 2021.
I move we approve the consent agenda as printed.
Second.
Oh, okay, you're good.
I have a motion by Dr. Brown and a second by Kim Ball to approve the consent agenda. Roll call vote, please.
Gaspard?
Yes.
Hannaford?
Yes.
Simon?
Yes.
Brown?
Yes.
Ball?
Yes.
All right, next is the CEO's report. Candace?
All right. You can see we've hired several new employees recently. One that is not on that list that we hired yesterday, her name is Karen Bentz. She'll be joining us beginning on Monday to help Jane and Rosemary. We're terribly excited about her. She's got like 14 years experience working at Blue Cross Blue Shield. So we're all looking forward to Karen joining us soon.
We got a new employee in medical records too.
We do. Her name is Tina Wessel, is that right?
Yes.
She's not on there either. So
Sorry.
that's okay. No, this came out, we all did our reports before those two got on there, so not a big deal. I don't know if you have specific questions about anything in the report, be happy to try to answer anything. One of the biggest things we've been working on is work with TrueBridge, trying to get a little further down the road on that project. Seems to have been going very slow, and so Chris and I have been, we've had a couple of conversations in the last week with Chris Bryan and trying to get some communication issues resolved, and hopefully we'll see some movement on that. Clinics, obviously those have been pretty busy. I will say COVID does seem to be slowing down. The front lobby is not overrun this week. Fridays are still pretty busy, but and Monday there were, I think, close to 50 on Monday or so, but today it started slowing down, so we're hopeful about that. We had to double up and pull providers and have 2 providers and 2 or 3 nurses in urgent care just to try to keep up with swapping everybody. It's been crazy, so be glad to see that slow down a little bit. Inpatient wise, we're down today. We're down to 3 inpatients, and only one of those had COVID. So we're making progress, I think. And if you'll notice, I do just want to read to you what I wrote, if you didn't get to read it. As far as vaccinating employees, we've vaccinated between 40 and 50 here at the hospital. Kelly will report his separately, but that's kind of where we're at. Everybody's received the vaccine that wanted it so far. But I had just wrote a little paragraph that I want to read to you because I'm terribly proud of the staff and how they've handled the increase in volume here lately. I want each one of you to know I'm super proud of our staff and how they've handled not only the increased volume of patients, but the complexity of their care as well. They do not complain, and somehow they keep smiling through it all. They have broadened their knowledge base and learned to take care of some very sick patients that normally would have been transferred that would have required ICU care in a metro hospital. Those beds are hard to come by and many times non-existent. With the help of Dr. Rader, Regina Wilson, Dr. Gulliford, and Amanda Stauffer, who's a respiratory therapist, we've acquired new equipment and learned from the best to take great care of these patients who could not be moved to other facilities. Not only are we caring for our community, but we are getting patients transferred in from all over the state due to bed capacity issues. We even got one patient from Texas. Our nurses and providers have proven their skills and acquired confidence that they can handle COVID-19 patient care up to the patient being needing to be put on a ventilator, at which point will be transferred as soon as possible, since we do not have a respiratory therapist on site 24/7 to manage ventilator patients. Our patients get more immediate one-on-one care here than they would in a larger facility. If you see any of our nursing staff, please let them know how much you appreciate them. They are on the front line fighting this pandemic day in and day out. They're hot and tired. They can't breathe under all of that PPE, but they do it, and they do it very well. Very, very proud of our staff. They've had a lot of challenges, and they did step up. So if you see any of them, please let them know how much you appreciate them. Do you have any questions related to anything in our 2 months worth of reports there? Busy, just honestly trying to keep up because of COVID. A lot of people have been pulled away from their normal jobs to go help with COVID, and just now beginning to be able to get back and kind of get caught up with quality and those kind of things. So, understandable. That's all I have.
All right, any questions for Candace? If not, I would entertain a motion.
Make a motion to approve and accept share medical written report for January 26, 2021.
Second.
I have a motion by Dr. Hannaford, a second by Dr. Simon, to accept the Share Medical Center written report for January 26, 2021. Roll call vote, please.
Hannaford,
Yes.
Simon.
Yes.
Brown,
Yes.
Bob,
Yes.
Jasper.
Yes. All right, Candace, thank you. Please relay on to all the staff the appreciation and the hard work is noted. Next, CFO's report.
First thing, kind of piggybacking off what Candace talked about a little bit, one of the first numbers is, we'll take you back in time a little bit to November, because those are the statements that we're at right now. First couple weeks in January, we spent most of our time and effort on the audit, which we're talking to the auditors this week again. And we're hoping our financial audit can be completed within the next month and a half. They thought maybe in March sometime. They're going to have to take off some time in February to get on some other work, but hopefully in March we can get this finally wrapped up. We kind of had to sit down with them because we felt like maybe some feet were being dragged a little bit there, but they were kind of stepped up and moving at a quicker pace now. So with that being said, these are November's numbers. We've started into December, so I'm hoping that we can get all of this caught back up within the next board meeting, or the next couple board meetings will be caught back up, so that we're kind of looking at a more present day outlook on the hospital. So the first number, if you have noticed the accounts receivable is getting higher. That kind of goes along with what we've been talking about with TrueBridge. In November it got higher. We haven't gotten December's numbers all the way computed yet, so I'm assuming it'll be around the same for December, but hoping that'll be something that'll be we'll see a trend that'll start getting better on that in the future. We already had a meeting today, and hopefully with what we saw today, things will start moving in the right direction. So, but obviously that number is higher than what we'd like it to be, so hopefully that will start to get better. Gross revenue, gross patient revenue, you can see on the income statement that the inpatient revenue was up and outpatient revenue was down. that kind of goes right along with the total patient days for November were more than doubled compared to October. A lot of that has to do with COVID, seeing a lot more inpatient on the floor. And then in turn, seeing less people coming into the clinics, so that's why those numbers are down. So you can kind of see if those kind of make sense with what you're looking at. Operating expenses were about the same as they were for October, which October was pretty high in and of itself. And that'll be something that we'll continue for the next couple months as we buy some COVID use a lot of the COVID money to buy the PPP and any big ticket items that we need. Salaries and wages decreased from the prior month. That'll be the last month that you see that, because if everybody remembers in December, we did start a COVID pay for all the employees and the nurses. So that number will climb in December and January. That is the difference would be paid from used with COVID funds, so it isn't something that should be too alarming. We have a couple $1 million still of COVID money that we need to spend back in November. For the most part, that's the hospital. A lot of what was happening in November that's when COVID was really starting to hit. So we saw a lot more inpatients, a few less outpatient, and then in December is when we kind of stopped with some surgeries. So kind of keep an eye on that as we go. You guys have any hospital questions? If not, we'll jump into the nursing home. And I'm sure Kelly will touch on this a little bit more when he talks. He talked about his report. You can tell the inpatient revenue is down. I think a lot of that has to do with COVID and then losing some residents moving out. Outside of that, he does a good job in keeping his expenses not real high. These are the expenses for November are higher than October. Most of those had to do with some projects for COVID. I know they're working on the Alliance and Bank Central were here. I know Bank Central in November, for the most part, was trying to get their camera system in place. So that's kind of the uptick in their operating expenses and why that was there. So kind of the same deal as the hospital. You're just going to see more expenses going out, which looks bad, but a lot of that's being spent with COVID money. And Steve will talk here in a bit that they, every now and then, they'll just keep getting a little bit more and a little bit more. The minute you think they're starting to run out, another check comes in. So that's kind of what they've been spending most of their money on. And you can see on the 2-year comparison how they're kind of just goes hand in hand with November, how it's down a little bit, year to date down as well from last year. But any questions? Okay. As far as the financials go, that is pretty much everything I have. You guys look through this. If anybody has any questions throughout the rest of the meeting, don't hesitate to ask or after the meeting.
Okay. If there's no other questions, we'll move to the next item. It's the discussion action on the application for the Payroll Protection Program through the SBA. This is round 2. We applied for round 1 back in May, June, somewhere in that neighborhood. We've submitted the forgiveness on that, and we were waiting SBA for that forgiveness. That time it was like $1,042,000. This time in round 2, it is about $1.5 million. So, what we need to be able to do to submit the application, and I am game to do the same process that we did before, as we left that money in a savings account until it was forgiven. They have not asked us to do that again. If we want to do that, to make sure that that money is forgiven before it's spent, I'm all for that if that's what we want to do as a board. Thoughts, questions on that?
I think that money, we're gonna be needing that money, well, depending on what they decide to do, what Medicare decides to do about the advance loan that they gave us, that's supposed to start being paid back in April. So, I'm hoping we can hang on to that money and use it to replace the Medicare payments that they're gonna keep from the government. And it's gonna be, the two of them together, if we get both of those approved, are gonna be more than what the Medicare was. So we'll have plenty of funds there if we can keep those in place until that time.
Okay. So maybe go to the savings first, and then if we have to.
I would say so.
Okay.
And probably need to talk to Alva State about whether they want that money there. I don't know. I don't know if that's causing them any problems or not.
They haven't complained about it,
Yeah.
but, what we need is a motion to approve the application, so that, we can finish that process for that round 2. And remember, this is for, wages, payroll protection programs for wages and utilities, and things such as PPE and other things that are not already covered by HHS money that we have received.
I'll make a motion to approve starting the application process for the payroll protection program.
Second.
We have a motion by Dr. Hannaford, a second by Dr. Simon, for the application for the payroll protection program through SBA. Roll call vote, please.
Simon? Yes. Brown?
Yes.
Bob? Yes. Casper?
Yes.
Hannaford?
Yes.
Okay. The next item is discussion and action on purchase of portable x-ray machine with COVID funds. Chris, you want to discuss that?
In the packet that I gave you, should be 3 quotes for a portable x-ray. The x-ray we have right now is old, and we do need a new one. In talking with our x-ray, our radiology manager today, she even said that it was kind of starting to go down quicker than what she anticipated and was having a hard time holding the charge. This is money, this is equipment that can be used with COVID money. So I asked her to give 3 quotes of 3 pieces of equipment that she would feel would be the most effective and efficient for her department. There's one from Canon. And if you need to see more, I kind of just gave you the main guts of the quote. If you'd like to see more, there's 18 pages worth if you want to really look at it. I tried to get this down to the smallest packet as possible, so that you can still be informed. But the Canon portable x-ray would be $109,000. The nice thing about this x-ray is that you can see from the other 2 is, which most of these are apples to apples. They're very comparable. The 3 quotes that she got, she tried to make sure that she was asking for the same piece of equipment. You can see it's $109,000. The Browns is $133,000, and the Siemens is $118,000. The nice thing about the Canon one is it's obviously the cheapest, but it's also the request of the radiology department. This is the piece of equipment that they think would be the best. They are comfortable with it. We also used Canon for the CT, and they've been very happy with how Canon has treated us with the CT, so they think that maybe this will hopefully we'll get the same kind of customer service that we do for this portable X-ray we do the CT machine. Like I said, this is COVID monies, and we do have this money already kind of earmarked for something like this, so it won't be anything, we'll pay it all up front. We won't finance it, we'll just cut a check and pay for it right then. Along with the portable X-ray, we also want to look at the warranty. Brown's came with a warranty and Siemens came with warranties as well. Both their warranties were, Brown's warranty was very similar, 5 years, $13,000, and the service contract with it was pretty comparable to the Canon warranty, which there were 2. We can do 6 years for $14,000 a year, which ends up being $84,000, or there's a 4-year, $13,000 a year for $52,000.
So you get 1 year for the most part with it, correct?
Yes.
Looks like you get a year on the X-ray tubes
Yep.
and 18 months on the image intensifier, or whatever that is.
And then on the next page, it shows, so this would be page,
How long, do we know how old the current one we have is? We talked about this the other day.
yeah, we did, I think it was 15 years old.
15?
The interest, and we do not have a warranty with the current machine right now. We have a preventative maintenance contract with the company that comes just once a year whenever we call, and they look at it and see what needs to be done. But outside of that, if anything would break, we do not have a warranty.
I might interject, it's my opinion that the warranty does not qualify for reimbursement from COVID funds. I think the intention of HHS and giving stimulus funds is that they're to be used during, as much as possible during the actual pandemic, as opposed to providing for something that's not even going to kick in for a year or 2 down the road. So that's my opinion. Of course, as you all know, I tend to be on the pretty conservative side on this stuff. So if anybody Kim, do you have any thoughts on that? Or?
And real quick, kind of like what Steve was saying, equipment, what comes with, the warranty that comes with would be 12 months for equipment, 6 months for accessory options, 90 days for replacement or optional parts that are not furnished pursuant to a warranty repair for the equipment, and then 6 months for upgrade components. So like I said, pretty much a year.
So my question is, can we purchase a warranty in a year? Because we don't really need the warranty right now.
Right.
Can we find that out?
Yeah.
Okay.
And I believe we can, and talking with Brittany, she's been going back and forth with Canon a lot. It sounds like that's something that they would be willing to do. Now, outside now, what the terms and everything would be like once we get there, I don't really know.
But we don't start paying for this warranty for a year anyways,
Correct.
right?
Correct.
Okay, I was not clear on that.
Yeah.
Right,
When
yeah,
the
this would
payment
be-
started for that.
Right, so we would go ahead and get this, we'd be covered for the first year, and then this would kick in.
Okay.
But the only thing that we'd be making a motion on is just for the purchase itself, and we're not doing anything with the warranty. Is that what I'm hearing?
The warranty can be,
Either or.
right, if anyone feels strongly about getting the warranty now, I mean, yes, we can vote on the warranty, yes or no on the warranty tonight, yes. I brought the piece of equipment is the main item that we really need to get voted on. The warranty, like I said, the warranty can be, we don't have to approve the warranty, and we can revisit it later on.
So the equipment's, and I'm one of these, how much, do we know how much of that is the annual, I mean, I don't see it on here, But how much of that is the annual maintenance and how much of that is the
Right.
warranty? The reason why I asked that, I mean, because really, your warranty, I mean, if you considered it all warranty, if you went with the longer one, you're spending $84,000 on a $109,000 item.
Yes.
And I'll just throw this out, and Candace, correct me if I'm wrong, I question how much that portable's gonna be used once we get outside the pandemic. I mean, how much do we use our one now? Is it used a lot, or does it just kind of sit in the corner and it's used every so often?
And I did leave that part out. The reason this does qualify for COVID funds is because right now, any patients that do have COVID, this is what we use to get their x-rays.
Right.
We go into the room instead of taking them
Right, we don't take
manually.
them to the main x-ray rooms, just.
Because you would
We
expect
will use
more
it, I
people
mean,
to
they
transport
take
them.
the portable a lot of times to ER, I mean, regardless of COVID, the portable will go to ER quite a bit.
Yeah.
So it will be
I can
used.
see it being used
Absolutely.
in ER, and then maybe, like you said, in patient rooms where
You can't
the patient's
transfer.
not mobile,
Right.
it's hard to get them around, so we just take the thing to them.
Right,
The preference is probably to use the larger
right.
fixed unit, probably gives a little better results, maybe, I don't know.
I can't speak to that, but
Yeah.
in those situations where you can't get the patient moved or it's very inconvenient,
Lately, it's been used a lot.
yes.
To me, that seems like a lot of money for a warranty on a piece of equipment that doesn't cost a whole lot more than that.
Right, that was my,
Well,
And
it's
this,
not-
I
and
know
we may
there's
be able to,
tubes.
Hold on, where's the maintenance and servicing part?
it's built into that.
That's what I'm asking. Is it in the warranty?
in the extended warranty,
Mm-hmm.
yes.
That's part of that,
Probably.
either the 13,000 or the 14,000 a
Right.
year.
Okay, I wanted to confirm that part.
Yeah.
And we can get, I can go back and we can get more information. If there's more questions that people have, we can go back and get more information and bring it back.
That agreement, that service agreement can be added at any time, or no?
We were told yes.
Okay. So I would be of the notion to approve the piece of equipment, and we can do the service agreement at another time if we so wish to do so.
And that, I think, is perfectly fine. I mean, like I said, the main item is getting this portable x-ray before it really dies on us.
The batteries are no longer holding charge, I have to
Right.
plug it in.
And we had talked in finance about this Canon. We did not have the warranty or service agreement at that time. And so, from finance, we had talked about the Canon being the one of choice, but again, we did not have the warranty or service. And I would be inclined that we don't, like I said, don't do the warranty at
You
this
seen the
time.
last word, Jill?
The point of purchase incentive is what I'm concerned about.
What's that?
There's a point in the Canon 13,000 annual payment. There's a
Okay.
point of purchase incentive. You'll receive this price, provided the equipment order is booked by 3/31 and the service agreement is signed and returned. If the terms of the incentive are not met, then the standard or GPO pricing applies. So that leads me to believe there's a change in pricing if they're not purchased at the same time.
This price right here was, this quote we just received this afternoon. This is the one that they've been telling us they've been working on, trying to get us a better deal. And this is the one that just came in this afternoon. So, yeah.
That does not change the price of purchasing equipment, it just might change the warranty.
The price of the warranty is what I think. It'll
Yeah,
change the price.
probably
The price
the
of the
further
warranty.
you go, the more it's gonna cost.
The further
Because,
out.
yeah, because if you're closer to needing it, closer to them having to pay. the more miles you get on the
Oh,
piece of
sure.
equipment, the more it's gonna cost to get an extended warranty, kinda like a car.
Well, so this still gives us, by the next meeting, this would still be in place by the next meeting. Well, the next 2 meetings, really. As long as we get this ordered, we would have, I'm reading this as, we would have until March 31st to get this price.
Yes.
So I would still go.
Yeah.
So it still gives us a couple months
To
to,
find out how much we use it during the normal time too.
and I can also ask, ask Brittany if there was any other extended warranties that we've used in the past of other companies that maybe we'd like. We can buy a warranty off somebody else.
Okay, any other discussion? If not, I would entertain a motion.
I make a motion that we purchase portable X-ray machine, Canon, the mobile Solstice 500 digital X-ray system. That that purchase be made with COVID funds.
Second.
I have a motion by Dr. Brown, a second by Dr. Hannaford, to approve the purchase of the portable X-ray machine from Canon, the mobile Solstice 500 digital X-ray system using COVID funds. Roll call vote, please.
Brown,
Yes.
Bob,
Yes.
Jasper,
Yes.
Hannaford,
Yes.
Simon. Yes.
Okay. The next item is discussion action on renewing the line of credit Community Bank. This is our line of credit that we usually use for operations, and it's this time of year that comes due. Currently, we owe nothing on that line of credit, but we like to have that open in case there is a time that we do need that. And so it is time to renew that, and so we need to have a motion to approve that line of credit at Community Bank.
I make a motion that we renew the line of credit, Community National Bank.
Second.
We have a motion by Dr. Brown, a second by Dr. Simon, to renew the line of credit at Community Bank. Roll call vote,
Bob,
please.
Yes.
Jasper,
Yes.
Hannaford,
Yes.
Simon. Yes. Brown.
Yes.
Okay.
Mr. Chairman, usually at this point, I give kind of a recap of where we're at with our stimulus funding. Can I do that with your approval?
Sure.
Okay. I gave everybody, I hope everybody, 2 handouts. They're both run the long ways on your page. If anybody didn't get a set, let me know. But the thicker one of the 2 is the hospital. There's a lot of numbers here, a lot of lines. I'm going to try to make this really simple for you and just hit the highlights. The left 3 columns that have numbers in them are the total of the other columns. So we're just going to look at the first total column, and I'm just going to run through some of the totals for you. First section up towards the top is the stimulus money that we've received since the pandemic began. Show the sources of the money, the amount we've received from each source. Total of $3.569 million. The next section gets into the usage of those funds, how we're recovering that stimulus money. First section is loss of revenue, so we're comparing 2019 each month to the same month in 2020. If 2020 is less, then we're recovering that difference as a loss of revenue. And sometimes it's less, sometimes it's actually more. We had early on in the pandemic, February, March, April, May, we were suffering and our revenue was way down. A lot of the hospital was shut down periods of time through there. So we experienced a considerable loss of revenue. Since then, we've recovered somewhat. We're having to shut down some things again, so we're kind of struggling as far as cash flow and as far as revenue, but this is one way we're able to recover some of that. So a total through December of $711,000 of lost revenue. Next section is operating expenses other than payroll, and that shows you by the week the amount of COVID-related expenses that we had during that week and that we're recovering by taking those stimulus funds to recover those. A total of about $511,000 of operating expenses. The last 5 pages of this handout are for the month of December. Each week as we make payments, as we pay bills, I've listed the COVID-related expenses we had this week. Probably a lot more information than you need, but just to give you an idea of how we can go through money up here, it's amazing. And something like COVID comes along, and it just dumps a whole lot more demand on our finances. So you can see there's a lot of money going out. That's really accelerated if you look at those operating expenses the last month or so of the year. Those expenses have really kicked up, and that's an indication of the activity, COVID activity, unfortunately, we're having in the community and the hospital and nursing home. So on the second page, there's a section called payroll expenses. Back in December, we started paying additional wages based on COVID. We paid some back pay to compensate for COVID-related extra work that was done prior to that, and then since then we've been paying a wage increase, an hourly wage increase, to help people get through the stress and demands of working through this pandemic. It seems to really be helping with morale and keeping people employed. Everybody's seen on the TV how nurses are being offered $10,000, $20,000, $30,000 to go work somewhere. It's really hard to keep people in place, but we've had a really good luck keeping people, and it's not luck. I mean, it's dedication to this facility and this community and the people here. I credit it all to that. I mean, I'm amazed by the people upstairs. It just takes my breath away. Anyway, we've paid out about $177,000 of extra wages in December. Now, that's not, we're not going to see that much every month. There was a big hit that first time we did it because of the back pay. But you can see we're trying to get the money out into the community to help people in the community that are working for us and dealing with this. Then the last section there is capital expenditures. We've purchased through the end of December, we've paid for about $747,000 worth of capital expenditures in the way of equipment and facility improvements. In December alone, we paid $486,000. Part of that is the final cost related to the remodeling of physical therapy entrance. The thought there is that physical therapy patients can go in through that entrance on the north side of the hospital, not have to come through the front door, not have to be in the main waiting room, not have to deal with registration there. So keep people away from where the COVID tends to show up in the hospital as people bring it in, so.
Is that the old ER entrance?
Yeah,
The old ER entrance.
yeah,
you're
so
exactly right.
when we did the remodel, that was never finished, so there was just a curve there, and it was dangerous, because you had to step up and then down at least a foot or so. And so, we had somebody come in and rework that, so it's wheelchair accessible. Patients have parking, priority parking by the building, so they're not walking. You think of how far your physical therapy patients, they were already worked out by the time, and tired by the time they made it to physical therapy. So it's been great.
Yeah.
So thankful we
Sliding
could do
glass
that.
door there, so easy to get people in and out. I would encourage you at some time when there's not a lot of people around and nobody gets in your way, but you might want to drive back there and just pull up there and look at it. It looks really nice. They did a really good job with it.
Yeah.
I'm very
We've
proud
got
of it.
signage, I don't think they've got it up yet, but we've got signage that they'll put up by the big door, and then there'll be two or three parking spaces that are specifically for them, so it'll look good.
A few of the other things that we've done in December as far as capital expenditures, we bought several air disinfection units that we use throughout the facility. They have HEPA filters in them and also a ultraviolet C light in them that removes the virus from the air as it's filtered through that thing. We've completed the purchase of the new CT scanner that we now have, and it's been in operation starting in December. And the old one was getting very unreliable, unpredictable. So we had to have this to be able to deal with our COVID patients, and it's been a blessing, really nice unit. We also purchased a transport ventilator and other equipment to deal directly with COVID. So we're really trying to use those funds in a way that's going to help the hospital, help the community, help deal with this pandemic and get us through it.
I will say, Steve, if I may stop you, just
Sure.
because I think some of that equipment has helped in this respect. If I'm not mistaken, and Chris or Kelly jump in here, hospital-wise employees, I can only think of 2 employees at the hospital that have contracted COVID. That's pretty amazing. I know one nurse did, and I know one person at the front desk did.
Yeah. One
And the
nurse
person at the front-
early on.
Huh?
A nurse
And another nurse
early
early on.
on, but that was almost.
I mean, when you think of what they're dealing with day in and day out, that's pretty remarkable.
Yeah, incredible.
It really is.
I mean, I think it's a reflection on everybody taking this seriously and really doing what they need to do and looking out for the people around them.
I agree, because
It all adds up.
I've heard other facilities that have struggled, not been able to take COVID patients because of their staffing issues, because their staff was, overcome with COVID. So kudos to the staff for their infection control precautions.
Yes.
And you just had to jinx it.
Oh, no.
And that also extends over to the nursing home. Every day I'm amazed by how they can operate the way they do. The people that come in and out of that facility, but yet they're able to pretty much keep COVID out of there. I know they've had some, but a remarkable job, I think, of keeping it out of that facility where it's so deadly when it gets in a nursing home. So Kelly and his staff and the staff here at the hospital are all to be commended for it. So when you add all those numbers together, we've used about $2.146 million of the stimulus fund so far at the hospital. We have about $1.4 million left that we can tap into for COVID-related expenses. Does anybody have any questions about any of that?
Is there a date, a cutoff date where you
Yeah,
have to
there
have
is.
money
I'm glad you
spent?
mentioned that. Right now, the cutoff date is June 30th. I don't know, I'm sure they're hoping they don't have to extend that date again, because they've already extended it once. Originally, it was December 31st, and of course, that didn't happen. But hopefully, by the time we get to the end of June, this thing may not be in the rearview mirror, but it's going to be more like a flu epidemic than a COVID epidemic, you know, as far as treating it and dealing with it. And I hope that's not wishful thinking, but we've got until June 30th to use those funds, so we have some time yet. As long as we have COVID in the facilities, I think we're going to try to continue our payroll practices and keep that going. So we'll see how, you know, this is such a fluid thing, changes day to day, but that's kind of the way we're headed. And that's what we've got at this point. I did file the other day a fourth quarter report with Oklahoma State University Office of Rural Health to report how we were using their funds. They're one of the entities that have given us stimulus funds, and there's going to be a lot more reporting to be done in the next, well, probably 9 months or so before this is all shakes out. At the nursing home, and the other handout I gave you, the one that's just 2 pages long, I'll run through it with you right quick. Top section is the sources of payments and the date that we received them. So you can see we've received more payments, number-wise, at the nursing home, but considerably less dollars. So at the end of December, we had about $619,000 of stimulus funds that we could use. Section below that, lost revenue. Kelly developed some formulas to determine how much revenue he's lost over there because of COVID. Came up with $287,000 of lost revenue through the end of December. Operating expenses other than payroll, about $112,000 through December 31st, and the second page shows the COVID-related expenses for December that were reimbursed from stimulus funds. Probably the biggest expense over at the nursing home is agency nursing. Kelly's had to use that, you know, to supplement the nursing staff. You know, there's been lots of issues with people having to isolate and stay at home. So he has to make up for that. He has to have bodies on the floor. So using agency nursing for a lot of that, and we're able to reimburse him for that through stimulus funds. Payroll expenses, there again, we're doing a similar program over at the nursing home, helping getting some more wages to those people that are dealing with this directly. Through December 31st, we paid out about $73,000 of extra wages. And then capital expenditures, Kelly had several projects over there, mainly to try to keep people either in the facility and safe from COVID, or keep people with COVID out of the facility. And of course, that's a full-time job when you have people coming and going all the time. So working on all those projects, a couple of them I think are close to completion, and I think hopefully the rest of them will be in the next month or so. And Kelly will talk more about that, I'm sure, here in a little bit. Total use of stimulus funds, $552,000 through the end of December. We've got about $67,000 of stimulus funds left at the end of December. I would like to tell you that in January, we've already received another $56,000 in stimulus funds for the nursing home. So you can add another $56,000 to that, but then you're going to have to subtract out a considerable amount for payroll and the other expenses for January. So the money, stimulus money, is a lot tighter at the nursing home. I don't know how much more there will be. I kind of think they're going to keep doling out some money because they realize that nursing home situation is tenuous at best in a lot of places. I don't know, again, how much more money we're going to get at the hospital. We have a change of administration. probably gonna go somewhat different direction. So things will be changing in the next few months. There again, this is a very fluid situation, unlike anything any of us have been through before, so we'll just have to see how it plays out. But that's kind of the current situation of stimulus funding. Any questions about any of that? I've been working with Kim. Baugh has been very nice to spend a considerable amount of time out here. We have some work yet to do, but I wanted to thank Kim for that. And also Jason. Jason has been a huge help with the PPP loan. He's ramrodded that, and right there we're looking at $2.5 million if all of that is approved. And that's going to make a huge difference for the hospital going forward. It's not going to solve our problems going forward, because we're always going to have money problems here, but we're going to be able to do some things that we've been needing to do for a long time. Like get a few more people here working, take some burden off of some of the employees that have really taken on a lot in the last few years. Just because we couldn't afford to replace people as they either retired or quit or whatever. So, any other questions? Anything? Thank you.
Thank you. All right, next item is the Medical Staff Executive Committee. Candace?
All right, so you can see the report from December and January. I will note in December, we do have on there that we reappointed Mark McCurry, that we discovered we are no longer using him, so that was not brought forward tonight to have you re-credential Mark McCurry since we do not use him. So for medical staff reappointment is being recommended Donald Simmons, MD.
I make a motion that we appoint courtesy staff Donald Simmons, MD.
Second.
I have a motion by Dr. Brown, a second by Dr. Simon to appoint to courtesy staff Donald Simmons, MD. Roll call vote, please.
Gasper.
Yes.
Hannaford.
Yes.
Simon. Yes. Brown.
Yes.
Baugh.
Yes.
And the next allied staff member to be appointed would be Callie Humphreys, PA.
Make a motion we appoint allied staff Callie Humphreys, PA.
Second.
I have a motion by Dr. Brown, a second by Dr. Simon to appoint to allied staff Callie Humphreys, PA. Roll call vote, please.
Hannaford.
Yes.
Simon. Yes. Brown.
Yes.
Baugh.
Yes.
Gasper.
Yes.
That's all regarding my stuff.
Okay. So the next is, if you go up to the tab of the financial statements, it'll be patient care. You have your QAPI.
So Quappy met, sorry, do you want
No,
to?
go ahead.
I would like for you to do this, if you like to. I do not mean to step on your toes.
No, go ahead.
Nothing really of note in December, out of the ordinary. In January, a couple of different things that don't routinely happen. We sent 11 charts out to an independent reviewer to look at quality for each of our practitioners. I believe we sent out a couple of charts for each practitioner from each area, so from the ER and then those that provide care on the floor. This is required in the re-credentialing process for quality, so that was just recently completed. And then we continue to talk about patient satisfaction and investigating ways to improve and try to capture that data that nobody likes to stop and take the time to give you. So we're continuing to look at ways of collecting that. I don't have anything other than that for QAPI. The other one was the contract review. They were all compliant. I think we archived one or two, and then the one that's not complete on OneNet, I'm just not sure about that. We'll have to take a look and see if we're still using OneNet.
Okay. Any questions about that?
Dietitian's report, nothing out of the ordinary noted on those two reports.
All right. So the next item then would be convalescent home report. Kelly?
December seems so long ago at this point, but we had in December about an average month for what we kind of had all the fiscal year. We did up until right at the end of December, we'd had such a good run keeping COVID out of the building, and then by the 28th we had 5 cases. By the 31st we had 11, and then by the 11th of January we got 21, and we have had some really good successes with those COVID patients, but we've also had some that weren't. So I think we were the first nursing home in Oklahoma, until somebody shows me evidence otherwise. I'm going to continue to say this, to provide BAM infusions within our facility. Tierna, our director of nurses, worked with the pharmacy staff at both St. Mary's and Woodward Regional or Alliance, whatever they go by now. And the folks here at Share, Regina and her staff were great help in getting us all set up to be able to do that in our nursing home, because at the time we were looking at, 6 hours outside of our facility for our frail elderly nursing home residents in order to get that service otherwise. So that was a really big deal, and by and large it was very effective. Not 100%, but for those that have done, that did have the BAM infusion, they did really, most of them did really well. Steve mentioned a lot of our projects. I won't go a lot more into those, except that we are still waiting on the doors from Stars. As soon as they get in, we'll get them installed. And we are still waiting on the wrap-up of our key card access system. It's not fully implemented yet at this point, however it is initiated. We did schedule, and I'm sorry I didn't bring the date with me, but we did schedule the HVAC engineering folks to be on site to look at our facility and start developing their plan for HVAC project. And February 1st we'll have our kickoff for our phase 2 of EHR implementation. So that'll take into the rest of the clinical piece of our electronic health record, as well as our GL and AP, accounts payable and general ledger. So we're looking forward to getting those things completed. We did have a COVID-focused survey from the state on December 9th. They cited us for 2 deficiencies, which is a great big improvement over previous years from what we've had with the state. But one was with regard to documentation of our orders for COVID testing of our residents, and so we corrected that before they even left the building. I'm surprised they even wrote us for it after that. But the other one was with our staff screening processes and not having a good, we've got the kiosks in place like the hospital has here. When we went to pull the information off those kiosks, there's one thing we didn't anticipate was the number of misreads that happened at times with everybody wearing masks, and the number of residents that
Get their picture taken?
get their temperature taken and their picture taken with our kiosks. So technology's great, but
exactly what it looked like.
we have had to submit a plan of correction to the state, which they did accept, and so we're on our way to having all of that wrapped up. They came back for a second COVID-focused survey last week, and we had 0 deficiencies on that. So Our staff have really done a great job. When a couple of asymptomatic staff members tested negative one day, and, we're not there for a while. We were testing our direct care staff every day, but he got in, and it's hard to contain at that point. So, particularly with long stay folks, and they have rights, and they don't have to do this, and they don't want to do that. And so it's spread. But I feel like we're on the tail end of that. We have had our first dose of the vaccine, and Thursday we'll have our second dose of the vaccine, and then they'll schedule for their final second dose coming up after that, 3 weeks. We did receive, and I don't think I knew it was coming, but I don't think I mentioned who it was at the last board meeting, but we did receive a $100,000 donation from one of our residents to the foundation. Warren, or Bud Nichols, and Maxine had both been residents at our nursing home, and they've had family that were residents at our nursing home, and in their death they left a lot of money to our entire community, but they left $100,000 to our foundation, so that was, it doesn't happen very often, and so that's very special and very much appreciated, and it's something that's going to be very useful for sure. We also had another resident who passed away, and her grandson, just a kid, and this is real heartwarming. I mean, I say kid, I can say kid now. Some of you will say I'm a kid, but gave us $3,000 to split up with the staff, buy them all chamber bucks for Christmas, and so had a donation for that, and that was really nice to be able to do. And so we've had a great amount of support from our community. We've had a rough few weeks here in January, but I will say that as quickly as it came on, I don't think we were ever, our staff is great. I don't think they were ever overwhelmed. I think there were things that they wish they had more control over, they just don't. But the staff has handled everything, really remarkably throughout this whole pandemic, and I can't, express my gratitude enough. We've had patients or residents that have, gotten fed up with all the rules, and they've moved to other facilities, or they've moved home, and 3 of them are back now. They missed us, I guess. And so, it's good to know that, we are making a difference in their lives, and maybe better than some other places might. So that's going to conclude my report, and I'm happy to answer any questions.
Any questions for Kelly? If not, Homestead Report? Is there anything to report there?
Yeah, just real brief. They've had a decline in population as well. Our census, they are sitting right around 70% occupied. They have not had as many people moving in because they have also, out of safety, they don't really have an agency telling them to not allow guests and stuff like that, but they had experienced a couple situations where family members knowingly hadn't quarantined and were coming into the building, so they just locked everything up and for a while, and they're getting to the point where they're starting to lessen that restriction with the number of cases in the county lessening, and so that's going well. They've got availability, so if anybody's looking for a place to stay, they've been working on getting some of the apartments refurbished, ready for the next people, and so. But they haven't had a lot of activity. They haven't had COVID to speak of. They've had a couple people that have had to quarantine as far as residents go, but the Homestead's really fared pretty well through all this.
Good. Anything else on the foundation? Other than what you already reported?
I'll have to wait, I can't remember.
Okay.
No.
Next item then would be the city council report, Bill.
Just briefly, our revenue continues to be fairly consistent each month. We are beginning our preparation for budget already for our next fiscal year. City manager and our department heads continue to do a great job in saving money when possible. We did have some budget amendments also that we had to pass for some CARES money, and also we were very fortunate to receive $100,000 as well from the Nichols for the library, which is going to, again, very generous, but also is going to go a long ways for our library. We did hear a pool report from our committee, and we also had a celebration for Craig Lambert, who retired from the Alva Police Department. And that's, I'll answer any questions.
Anything? Bill? If not, thank you. Last time I just did a kind of a closing comment. I had 3 encounters in the last, we'll just say 30, 45 days of bringing folks to the ER and people that were interacting with the staff in regards to with COVID. And every single time, both the families and the people were very, 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 very appreciative, and the staff was very, very professional and was superb. And I think we are very lucky to have who we have and what we have, and we need to just be grateful for all the times that we've struggled and things of that nature. Without this place, this whole place, during this pandemic, we'd have been a world of hurt. And so thank you to everybody, if that can please be echoed everywhere that needs to be echoed.
Kind of along what Jen's saying, I wish we had, our director of nursing, Regina Wilson, up here. And Candace probably knows the stories that she's told of other facilities in Oklahoma City and the things that they say about share. I mean, I wish it was something that could be advertised so that the people in Alva could hear these things, because there's some doctors that say that they will send here and they won't send to a lot of other places. And it's just,
I had one of our providers tell me the other day, I think he was in Red River one time and then somewhere else, and he said that when they got to visiting and he told them where they worked, they told him that they had heard that Share Medical Center had a great reputation and gave good care, and I was like, oh my gosh, that felt good.
Yeah.
That felt really good. So staff's doing a great job. Like I said, I couldn't be more proud of them. I think the morale is probably better than it's ever been. I think the challenges that a pandemic brings, I think you can go one of 2 ways, and ours chose the high road, and they've hung together, and it's brought them closer together. And
You talked about morale, we didn't have any turnover in our nursing department in December.
David said he figured it, our turnover rate was at 3%. That's pretty incredible.
All right, well, thank you, everyone. Have a great evening. We are adjourned.